Good morning, my dear friends. How are you? I am sure you are always fine because we have developed our habit to make always a positive thinking and positive attitude. That's why we can make our life more happy and healthy and also the long life. We are talking about Ayurveda for all cereal. This is a specific cereal which is developed by Professor Dr. Deshpande, it is myself, and the intention is to spread the life science, Ayushaha, Vedaha, Ayurvedaha, in a very simple and lucid language throughout the world, but at the same time with a scientific background. We are talking about the basic or the fundamentals of Ayurvedic science. We are talking about the bioenergies, that is Vata, Pitta and Kapha. In the last 7 sessions, I have talked about the functions of Dhatu or the body tissues. What are the very interesting or very topmost Sreshta Karma of Rasa, Rakta, Mansa, Med, Asthi, Majja and Shukra. Now, from today, that is the 1st of May 2019, I would like to continue the serial Ayurveda for all with a little discussion on the important function of the waste products. That is the gross or the sthula mala. Gross waste products are called as Mutra, Purisha and Sweda. These are the Sanskrit names. Mutra means urine, Sweda means sweat, and Purisha is the stool or the defecation. Okay, we will talk about the Mutra today. Now many people are asking why Ayurveda is giving so much importance to these urine or the stool. They are after all waste products. Why you have to worry about waste products? No, Ayurveda has a very important principle that dosha dhatu mala moolam hi shariram. That means dosha bioenergies, dhatu body tissues and the mala, that is the waste products, all together are considered as the moola, that means like a very similar to the roots of the trees. As the roots are important to the trees, similarly dosha, dhatu and mala are important for our human body to maintain our physiology, to prevent the pathology. So we must consider the bioenergies, we must consider the body tissues, but at the same time we must consider the waste products. Because waste product gives you the idea whether my metabolic process is going on well or not. All my physiological activities can be considered as a metabolic process. They are included both anabolism, that is the growth and nutrition, and catabolism. Catabolism is similarly important. We require RBCs, that is okay, but RBCs after few days it should be destructed. That is after 120 days each RBC will die and new RBC will come. This is the nature's cycle. We all are here, we live some days, then we go off. We go to the heaven. But new generation comes. Similarly, in our metabolic process, some nutrients are developed. They are called as the Sara Bhag in Ayurveda. Sara part, that is essential raw material nutrient parts. But at the same time, Kitta, remember this word, Kitta. Kitta part, whenever metabolic process, Sara useful part, Kitta waste part. Now this waste part gives you the idea whether my metabolism in the body is going well or not. So that's why dosha dhatu mala moolam hi shariram. And what is the definition of healthy person? Samadoshaha samagnischa samadhatu malakriyaha prasanna atma indriya manaha swastha iti abhidiyate. Who is called healthy? Homeostasis, balanced. Of what? Samadoshaha, bioenergies, samadosha, samagni, digestive fire, samadhatu, tissues, and samamalakriya, malakriya. There the word mala, mala is a waste product. Just now we will talk about, so we will start with the mutra, that is the urine. Now there are a lot of interesting things what Ayurveda has mentioned about the urine. Urine is a liquid waste part. Purisha is a solid waste part. So after our primary digestion, when we eat something, proteins, carbohydrate, fats, they go from mouth to the stomach, to the small intestine, to the large intestine. And in the small intestine, Sara Kitta Vibhajana, separation of the useful part and waste part is there. And from the Pakvashaya, very interesting. Some modern people, they will confuse, but don't get confused. Remember my words. See this video again and again, what I am telling you. Modern science tells that urine is formed in the kidney by the filtration of the blood. That is very correct. There is no doubt about it. But Ayurveda has given some more information. Ayurveda says that Sara Kitta Vibhajan, separation of nutrient and waste part, takes place at the end of small intestine. So in the large intestine, Pakvashaya, Ayurveda has mentioned the actual process of formation of raw material for the urine is starting in the Pakvashaya. Very different aspect. Some scientific people, they get shocked, but please don't get shocked. Ayurveda says that raw material for the urine formation, processes will start in the Pakvashaya. And why I am telling you stressfully, Ayurveda says the raw material formation. Because only if you say urine is formed in the Pakvashaya, all the modern people, all the scientific people, they will say Ayurveda is bhankas. Ayurveda is a shit. Ayurveda is a waste. That means it's a useless science. What they are telling about? Urine is formed in the Pakvashaya, large intestine. They don't get shamed. No, don't get excited. Although I am get excited. I am saying that raw material for the formation of urine will start the process in the Pakvashaya. My teacher, Vaidya Yago Joshi sir, very well known Ayurvedic Vaidya in Pune, Maharashtra state, India. He has made a lot of experiments in front of us. Whenever the cases coming for the anuria or the oliguria, many reasons are there for less amount of urine. Then what he has tried? He has tried Vajhedi. Remember, this is the Marathi word, I know. That is a part of large intestine from the goat. He always used to bring that the intestinal part of the goat, he make a soup of it and he asked the patient to give that soup, the patient of oliguria and anuria, because he says, Samanya Vishesh Siddhanta. Urine is starting in the Pakvashaya, okay, Ayurvedic fundamentals, then I will bring the goat's intestine and make it soup and give to the patient. Because of that Vajhedi, that is the soup of the intestine of the goat, that is helping a lot in the patients of anuria and oliguria. So I request all the scientific people, please make scientific research on this topic. We have seen these cases with our teacher Vaidya Godoshi sir. Now I will tell you the important function of urine. Mutrasya kledavahanam. Kled is the word. To transport the kled from the human body, from all the cells, bringing into the blood, going into the kidney, there is a filter, glomerular filtration will take place, and then waste product, the maximum waste product is the water. Remember, urine is maximally of water. So water will carry all the waste, minute waste products created during the metabolic process of all the tissues. Rasa, Rakta, Mouse. There are a lot of waste products are developed and they are carried through the blood. They are filtered in the kidney and then the urine is formed. So kled means minute liquid waste product developed at the time of tissue metabolism. I will tell you how the urine word has formed. Urea in. U-R-E-A. Urea in. So urea is the most important kled. Most important kled which is excreted through the urine. Second is hydrogen ions. Acidic. They are excreted through the urine. By chance, if your kidney function is damaged and Mutra is not going properly, what will happen? Mutra will stagnate in the body and the urea will not go out. And then urea will accumulate in the blood and that is called as uremia. Uremia is a very, very serious condition, mind my word. Very serious condition. Patient first unconscious and coma and then he may die. So uremia, why this is happening? Because of the problem of urine. Are you getting my point? So urine is important. Urine should be passed physiologically 1/2 to 2 liter in 24 hours. This is quantity. It should be passed without pain, without burning, without any RBCs, pus cells in it. So there are so many criteria how your urine should be. And that is why it is important. If you pass a lot of urine, that is polyuria, is a problem of diabetes mellitus or diabetes insipidus. If you don't pass the urine, uremia will develop. So, quantitatively, qualitatively, frequency wise, it should be important that urine should be well formed, well maintained and well excreted. Are you getting my point? That is why there are a lot of points which should be considered when we talk about waste product. And urine is one of the important waste product which is having the function mutrasya kleda vahanam. Kleda means like urea, sometimes a little bit sugar, sometimes some organic and inorganic compound, all are kleda according to Ayurveda. So I hope you have a little bit started to get interest in the knowing the functions of waste product. I will talk about the waste product of Purisha next time. Thank you very much. I request all of you, please subscribe my YouTube channel. Thank you.